This is Richard Wolff from Democracy at Work, responding to another Ask Prof Wolff question from our Patreon community. And this one comes from Brandon Desiderio. Brandon picks up a question from a book or an interview of the author, Gabriel Winant, W-I-N-A-N-T. And the book is called The Next Shift, and it's about the transition in the Rust Belt of the United States from industry in the past to the healthcare business in the present. And what Brandon wants to know, having been stimulated by the interview and the book, is what we have to say, we as advocates of worker co-ops, about the need for, the possibility of, the benefits from a cooperative organization of the healthcare industry. So let me respond briefly, but I hope to the point. Number one, worker co-ops have existed in the healthcare industry, both inside the United States and outside the United States, for a long time. There is no problem in reorganizing healthcare, a doctor's practice, a hospital, a clinic, and so on, with a worker co-op organization. And the same applies to the production of medicines, devices, and so forth. No difficulty in conceiving or understanding or seeing empirical documentation for the existence already of that way of organizing healthcare. But I want to make a claim that's much stronger. I want to make a claim that the failures of the healthcare system in the United States, and by failures I mean that we don't have a national health insurance as every other advanced country has, that we didn't do well when our medical care system was tested by COVID over the last 2+ years. Why didn't we do well, or how do I measure that? Simple. The United States has 4.5% of the world's population, yet we account for 16 or 17% of the world's deaths from COVID. That is a failure. There's no fancy way to dance out of that situation. We are a very wealthy country. We have a highly developed medical care system, but it doesn't work real well for the mass of people. We suffer extraordinarily from an opioid overdose crisis. We are one of the worst countries in the world for overweight problems, obesity. I could go on. The last few years, our longevity, how long we live, has come down, not gone up as it has in most other countries. And our birth rate has been cascading down to where our population would have shrunk over recent years were it not for the immigrants who are having a harder and harder time coming here, which means that we expect already perhaps in this year to record a declining population, not just one whose growth is shrinking. I could go on, but our healthcare system leaves a lot to be desired. And the reason is it is a profit-driven system. We have been privatizing our health system at breakneck speed over the last half century, closing public facilities and converting them into private, profit-driven entities. And that profit motive is built in now to healthcare. It's built into hospitals. It's built into the doctors' practices. It already was in the insurance companies, and it already was in the medical device, drug, and so on companies. Profit is everywhere. And as you know, profit means that the people in charge, the tiny number of folks who run capitalist enterprises, are driven to be cost effective. That's a fancy term for cutting costs, making 3 people do what they used to do with 4 people. replacing people with machines, outsourcing anything and everything to cut corners. So no one should be surprised, even though so many seem to be, that we are all suffering. Why? Has all this cost cutting led to our medical care being cheaper than in other countries? Absolutely the opposite. We spend more for medical care in the United States than any other advanced industrial country. So what is it that it produced all the cost cutting? Really good profits, extraordinary profits, collected in the hands of a tiny minority of our people, the shareholders of the big corporations, the top executives who make all of this happen. And at the bottom of the food chain inside healthcare activities, the nurses, the orderlies, the workers on the line, they've been squeezed, making it impossible. That's why we have so many resignations in the healthcare field. People are driven to work unspeakably hard with not enough support. And now, in the midst of a very scary disease, with the companies trying to save money rather than make sure that the workplaces are safe, I could go on. Bottom line, yeah, we can make the healthcare industry a worker cooperative based industry. It's been done. We can do it again. Americans are just as smart as learning how to do these things as everybody else has been. And we should do it because our healthcare system produces mediocre results the way it is now. It produces mediocre results, even though it costs us more than other people pay in other countries far less wealthy. Who wins this? Well, it's the perfect capitalist story. A tiny number of shareholders at the top. And remember the basic statistic: the richest 10% of our people own 80% of the stocks, and that is particularly true in the medical field. So yeah, we need to make big changes, and we should and we could start right there in the Rust Belt that needs it so badly by a massive program of converting capitalist businesses, profit driven, into worker co-ops. It is the better way to go. If you find this interesting and imagine that other people might as well, please partner with us. Help us extend the reach of these short explanations that we produce. Share them with your friends, your relatives, your coworkers. That's why we produce them. We ask that partnership, and of course, if you can help us with some financial support, our website, democracyatwork.info, will show you all the ways that you can do that. And please know we will use that money to extend the reach of these videos as a basic part of our work. Thank you.